Okay. Good evening. Hi, guys. Thank you for joining. Dr. Q's already here. We're just going to wait for a few guys to come on board. We're talking about blocked fallopian tubes and conceiving with one fallopian tube. Tonight we're talking to Dr. Q again. So thank you everyone that's joining. I see everyone coming on board now. It's Fertility Talk again with Fertility Solutions. And thank you everyone that's joined us this evening. So I got a request already and we're going to accept. There we go. Thank Dr. J. Hi, Islin. I saw you. Thanks for joining. Okay. Go, Dr. Q. How are you?
Hello. I'm awesome, thank you. How are yourselves?
Good. I'm so glad you're joining us again. This is so nice to have you 2 weeks in a row. And we're both sitting on couches this evening. We are absolutely comfortable, relaxed. We're just going to have a conversation tonight. Okay. So you've been well?
Sorry?
You've been well, doctor?
Yes, I've been well. I've been awesome, thank you. Just very tired.
I was actually a little bit tired.
Yeah. Somebody was talking to me over the phone and like, you sound really tired. I'm like, oh my word, I've got a life. And you're picking it up. So I had to like wash my face, make myself a bit wake up.
No, I feel it. I feel it with you. So we're talking about blocked fallopian tubes. But I first would like, because there's always new people that's joining us, so I'd like to take the time to, if you can just introduce yourself, tell us who you are, tell us where you're from, please.
Okay, great. So I'm commonly known as Dr. Q. I am a gynecologist and I'm also a fertility specialist. I focus mostly on infertility because that's my passion and that's my super specialty. And I run a fertility center in Centurion in Pretoria called Family Matters Fertility Center. And I'm excited to be part of the wonderful team of people that works there. So we do a lot of education and awareness for people, trying to make their lives easier and also trying to get them to get assistance in ways that they can. The earlier, the better. So whatever we can do to make a difference and a change in people's lives, we're there.
Yeah, I also see that you, sorry to bring this up, but I see that you're running a egg donor drive at the moment. You maybe want to just quickly touch on that.
Yes, we are running an egg donor drive, especially which is specifically aimed for people who do not have eggs, either because they were born without eggs or they ran out of eggs due to age or diseases like primary ovarian insufficiency. There's a lot of reasons where a woman cannot actually produce eggs. And they still want to conceive. So the hope of motherhood is still there. As long as they have a womb, they can either have a donor sperm or their partner sperm, and then we assist them with egg donors. And we are in dire need of more donors. We're looking at girls that are between the ages of 20 and 32. Not any to mean any offense to anybody that's above 32. It just has to do with age and the quality of the eggs and the numbers of eggs that can be produced in one cycle. So we're looking for young women that are between that age, also with the body mass index between 20 and 28. That is good because then the medication can get to the eggs better and not a lot of medication is used. So it becomes less expensive for the recipient. And also for women that do not smoke and women that don't drink, because smoking and drinking also affects the quality of the eggs that we get. So if women are available and they would love to be egg donors to make a difference in other people's lives, they are welcome to register to become an egg donor. at Miracle Gift. So you go to the website www.miraclegift.co.za, and they're able to put in their names. They go through a screening questions, which is just what I've just mentioned.
Yeah.
And then there's a nice long questionnaire where we want to know about your family history. Do you have any illnesses? What's the color of your skin? What's the shape of your eyes? Are you Korean? What are you? Big round eyes like Dr. Q, so they can just have an idea what their baby would look like. And then from there, we are able to accept you as a donor. You go through blood tests, you go through a psychological chat, which is like an assessment, and then we do the egg retrieval, which does not involve any cutting or operations. We sedate you, put you to sleep, you're comfortable, and we're able to get the eggs, and off you go. It's a 2-week process maximum. 2 weeks, all is done, and there's a compensation of 7,000 Rand for everybody that donates eggs. And it's not an amount to say thank you. Saying thank you, there's no price to it. There's no amount that we can put to the altruistic act that you're doing to bring about a life. There's absolutely no amount, but it's just to say thank you for your inconvenience and making yourself available. So 7,000 Rand. That is the legal limit that is set by the South African law. So we're looking forward for young girls to come through. If you know anybody, just spread the word, and we'll be excited to have you join us.
Awesome.
Thanks for that.
That sounds great. Thank you.
Yeah.
Thanks, doctor. Okay, so we're going to get into our topic tonight. We're talking about blocked fallopian tubes, but also talking about, like you said last week, everything regards to the fallopian tubes, and can you conceive with one fallopian tube, all of that. So the first question is, what is a blocked fallopian tube?
Okay, so a blocked fallopian tube, firstly, let me just explain the function of a fallopian tube and why are we even having this conversation about a fallopian tube. Somebody said, I just got a question from my embryologist today saying, somebody sent a message asking that now she has donated eggs before and now she wants to fall pregnant and she can't fall pregnant. Could she still be fertile? And our response was, no, it's not because she donated eggs before that she now can't fall pregnant. There is a whole system that is involved in falling pregnant.
Yeah.
And it could be a factor of her womb, it could be a factor of her ovaries, it could be a factor of the tubes. So maybe she could give somebody else eggs and she still can give eggs, but she can't fall pregnant because her tubes are blocked, because that's the key role that the fallopian tube plays. I wanted to bring my model for this talk, but unfortunately I forgot it at the office. So that's the advantage of actually doing the talk at the office, because you can just quickly grab something because it's there. But it's very important to know the role of the fallopian tube. And I always call the fallopian tube the factory of baby making. So when you want to develop anything, mass marketing, you need to have a factory house where everything is manufactured. Then when you've manufactured, the factory is messy and all of that, and then you move your stock to your storage, your storehouse, okay, where everything is stored and kept neatly and done, the finished product. So all the work is done in the factory, and that's the job of the fallopian tube. It's the factory. That's exactly where the baby is made. That's where egg and sperm meet each other, In Zulu, we call it ukshelana, where the boy asks girls out, Bafreyana, they have that talk, and the girl like, no, I don't think so, That all happens in the fallopian tube, and that's why it's so important. So if the girl's like, no, you're not my type, then nothing happens, and then there's no baby made in that factory, absolutely zilch. So that's how important the fallopian tube is. So if the sperm cannot get to the fallopian tube, then there's no baby made. If the egg does not get to the fallopian tube, there's no baby made. So the baby is made in the fallopian tube and it travels from the fallopian tube. Now we're moving our products from the factory to the storehouse where the actual action happens. So the the baby then, after fertilization takes place in the fallopian tube, the baby is then transported, and the fallopian tube has got like it looks. Think of a person running the marathon, and the people on the side who are cheering them on all along the road. So they are cilia. They are small little I don't know how to describe them, but we call them cilia. Small, I had a word for them, but they sweep the baby towards the storehouse now, which is the womb itself. So they're busy cheering the tube on. And that also is very critical, because if those are damaged and they're fine, they look like, I always make an example, like, you know, the hairs in your nose and in your ears. Yes. So they look like that, but you can't see them with the naked eye. They're so fine and so, you know, so small. So that is what you also find in the fallopian tube. So they cheer the baby on for about 5 days, traveling from the fallopian tube into the womb. Then the baby gets to the womb. So the baby is not made in the womb. It's actually made in the fallopian tube. And that's why it is so important. So now, what do we mean when we say the fallopian tube is blocked? I always say it's like you want to go home, and on your way home, you're driving, and you learn that there is a roadblock ahead, and you don't have your license with you. And then you're like, it's either I get a fat ticket or I'm going to jail or something like that. So do you continue driving the same route, or would you want to like do a U-turn and, you know, take a long drive home? Exactly. So a fallopian tube is like that. It's also like a bridge. It's like a broken bridge. You want to go to the other end. Remember, the baby must travel now from the factory to the storehouse, and the bridge is broken. Then there's no traveling for the baby. So that is what it means. It's either a roadblock, the police are there, there's no license, baby can't pass, or there is a broken bridge. Now the sperm can't go to meet the egg on the end of the bridge. And the egg only waits at the beginning of the bridge, in one part of the fallopian tube at the beginning. And if the sperm cannot get there, no baby is made. So that is what we mean by a blocked fallopian tube. And there can be different things or causes of a blocked fallopian tube. I think probably that would be the next question.
Yes. So what causes a fallopian tube to be blocked, or what blocks a fallopian tube?
Okay. So it could be many different reasons. A simple reason is someone like me who felt like, hey, I'm done with baby making, grandy, no more babies, I want a permanent solution. And when they do your Caesar, you're like, cut them tubes, remove that bridge, cut that bridge, let the London Bridge fall down, you know, no more babies, you know. And then you find that for most women, you know, after making that decision, either because, and I always ask women, is this not an emotional decision? Yes, sterilize me, doctor. I've had enough. No more babies. I get very sick. Or maybe she's just upset with her husband at that time, and she's like, you know. Or maybe because there was a difficult pregnancy. Maybe she had to stay in hospital a whole month before she delivers. And then she's like, I'm done. So we need to make sure that there's no emotional decision. So women actually sterilize. Others, it's not emotional. It's a set decision. But they have 2 kids. They don't want anything more than 2 kids, and they sterilize. And then they lose a baby, or they lose both babies, or they lose the father, and then they meet somebody else. You know, life happens. And then you find that the tubes have been cut or sterilized, and now there's no factory for baby making. You have the storage, you have the storehouse where the baby grows and comes out, but you can't actually make the baby. And that's one of the examples where women have been sterilized. The second example is when women have illnesses that affect the tube internally, you know. So the tube is a round organ like this. So anything that comes up and closes this tunnel and then blocks it. So that could be instances like infections, and there are different kinds of infections. It could be sexually transmitted infections, and unfortunately, women, hear me, you know, a lot of women don't even notice that they've had STIs before or STDs or whatever. And only when we go in and we do probably a laparoscopy for something else that we find that this woman has been messed up on the inside. Remember, the fallopian tube connects to the womb connects to the mouth of the mouth of the womb connects to the vagina. So anything that happens in the vagina can go all the way up to your intestines and affect your intestines, believe it or not. It can even affect your liver, anything that happens in the vagina. So the vagina, if you have an infection vaginally, it can climb up and cause damage or inflammation or infection of the vagina, then it's vaginitis. Then it can affect the cervix, it's cervicitis. Then it affects the lining of the womb, it's endometritis. Then it can go all the way to the tubes and cause infection of the tubes, that's salpingitis. And then the tubes are open like this. It's got what we call fimbria, and the tunnel in the tube is there. It comes out, it goes all over your pelvis, it goes all over your abdomen. Then you find that the liver is affected, the bowel is affected, the whole pelvis is affected. So if now the sickness or the infection is so thick, it can end up just blocking the tube, and then that's it. And most women don't know. So that's why it's important to actually get tested and to see if your tubes are actually still open or not. Then there's infections like TB that affect the blockage of the tubes. There's what we call SIN, and even things like endometriosis. Now, endometriosis does not work mostly inside, but it works outside, where it actually kinks and blocks. You get an adhesion. Instead of having a tube open like this, it goes flat because there's things on the outside that are actually blocking and kinking the tube, that the sperm cannot go and meet its goal, and then no baby made.
Wow. Okay, I had no idea that the endometriosis could also affect it in that way.
Oh, really badly.
What are the signs and symptoms of a blocked fallopian tube? I don't know if there are signs and symptoms of it, but yeah, what are the signs?
It's not falling pregnant.
Oh,
unfortunately, you know, not falling pregnant is one of the signs of a blocked fallopian tube. But unfortunately, you can't sit and feel, I think it's my left tube that's blocked. You know, unfortunately, it's not something you'll be aware of unless you have swollen tubes that are really thick, and then you've got pain, you know, on the left, and then when you go for testing, then we know, especially for PID. If you've got pelvic inflammatory diseases, then you've got pus coming out of the vagina or a very smelly vaginal discharge. Then you've got pain on one side, sometimes both sides. You get a fever and all of that. Then that's pelvic inflammatory disease. And then it's an indication that the tubes most likely will be blocked. But we can't confirm it until we do the proper diagnosis or tests that are done to confirm that the tube is blocked.
Yeah. Okay, so can it be treated? Can a blocked fallopian tube be treated? Is it something you can take? Is something they can do?
Okay. So treatment for a blocked fallopian tube, unfortunately, it's more like saying there's next to none. But if it was sterilization, and now you've sterilized, your tube is blocked, and you want to have a baby, then we have a procedure that is called re-anastomosis or recanalization of the fallopian tube. I must say that it takes a lot for us to go in and say we are recanalizing, because we do get about plus minus 25% of successes, but there is a criteria. You know, you must have a good anti-Müllerian hormone, AMH, ovarian reserve. we must make sure that the sperm is actually quite good. You must have a normal sperm test, because there's no point in us going to recanalize your tubes only to find that your guy has poor swimming or poor concentration of sperm, and you still need IVF. You understand?
Yeah.
So we need to test your partner's sperm. We need to test your ovarian reserve. And then when we go in, we must have a tube more than 4 centimeters that is left, because if it's a very short tube, it can't even reach the ovary, then there's no communication between the ovary and the fallopian. So there's a long procedure, and only fertility specialists are allowed to do that procedure. And there are risks that are also involved with re-anastomosis, and that is the risk of an ectopic pregnancy, where yes, a pregnancy is achieved in the tube, but the passage or the bridge is so narrow, the baby can't even travel to the womb. And then the baby gets stuck in the womb, and that is life-threatening. You can get an ectopic pregnancy. So we usually say, look, instead of going through all these risks, you might as well just take the long way home and do a reverse and get your baby made in the laboratory, and you go through the opposite route. Instead of the baby coming from the fallopian tube into the womb, let the baby be made in the lab and come down through the vaginal canal into the womb. Same storehouse, same baby. So, and then there are things, can there be things that you can take? You know, unfortunately, I hear women, and I'm going to say, that they'll be talking about yoni steaming and herb steaming and all of that. I wanted to actually have the picture. They must just go and look at a picture of a womb, and you will see that at the top of the vagina there is a very tight cervix. It's tight like this, like, you know, it's closed. It's closed, and yeah. It's now we are saying the steam that you're sitting on and boiling over is going to penetrate this closed hole like this, go all the way up the vagina, all the way into the cervix, all the way into the womb, and go to and locate the cannula into the openings into the fallopian tube, and get there and fight that TB and fight that STI and loose everything. Like, guys, some of the things, I think we need to be more knowledgeable. And I must warn women and men out there that there are people who are out there to make money, just to make money, you know. I always say, if I could do IVF for free, I would. Like, seriously, I would. Unfortunately, I import things from overseas that cost me hundreds of thousands of rands, you know, and then money needs to be spent for these procedures to be done. A simple IVF needle is like 1.2. So unfortunately, I can't give so much money for free, you know, but there are people then who use our desperate situations to just make a killing for themselves. Yeah. And we need to be very cautious. So can there be something that you can drink or whatever that takes away or unblocks tubes? Medically and scientifically, unfortunately not. There are people then, I remember I did a live one of the some years back, and somebody says, yeah, I drank, and people actually use these lives to come and write messages and promote their own stuff here. So somebody wrote that, but I drank wara wara, or I steamed or something like that, and my tubes were blocked. You know, sometimes you can get an instant where it looks like the tubes are blocked, but maybe it's just phlegm. And that's where I'm coming to the next method of what can be done. And then you fall pregnant because you were going to fall pregnant, not because you steamed and you drank this and you drank that, you know, and now, you know, that has suddenly miraculously unblocked the tubes. And, you know, when you see a blocked fallopian tube, sometimes I think in these lives we must have an opportunity to do a presentation, like if I can show a PowerPoint presentation. Unfortunately, I had to take out tubes of a young lady. And when I explained them to her, and she was trying to fall pregnant and she was sick, and I needed to take out fibroids and all of that, and her tubes were like sausages, twisted sausages, like this, like, you know, a caterpillar that's twisted and swollen and full of fluid and all of that. And now we say you going to sit on a hot bucket and some herbs are going to unblock that. And they become hard, the tubes. They're supposed to be a soft tissue, you know, like polony or something. But they become as hard as wood when we touch them sometimes because of the blockage. It's like they cement inside the lumen or the opening of the tube. And then in other areas, they are swollen as a sausage. And they're supposed to be half my pinky finger. That's how small a fallopian tube is. But then you find that there's a swelling like this. And then steaming is going to treat this, guys. No. So unfortunately not. But if there is conditions where the tubes actually look normal size and the blockage is not too much, maybe there's just collection of phlegm or some fluid, then there's a procedure that is called hysteroscopic recannulization, but it's also not too common and it doesn't always unblock the tubes. You know, the success rate is very little. It's done by radiologists, people who do x-ray, the same people who do the test that diagnose the blockage of the tubes, and then they are able to then go in vaginally and go in through the cervix into the womb and push a catheter that is able to just dislodge whatever could be there. But if it's serious swelling and distortion of the tubes, unfortunately, there is no treatment for blocked tubes. We just need to say roadblock. Let's look for alternative methods. Do a U-turn. Use the back door, unfortunately.
Yeah. Okay. Can I conceive with a blocked fallopian tube?
If it's blocked, it's blocked. Unfortunately, it means egg cannot meet sperm, and that's where the factory is. Unfortunately, the baby cannot be manufactured with a blocked fallopian tube.
Okay.
Unless you use alternative methods.
Yes, there we go. Does a blocked fallopian tube affect my period? And if so, how? Could a blocked fallopian tube?
No, it doesn't. It will only affect your ovary if you have what we call oophorosalpingitis, where the ovary is sick and the fallopian tube is sick. And then the infection goes, remember as I was saying how the infection climbs? So it can climb through the fallopian tubes into the ovary. And then your ovaries can also be affected. You lose eggs. The quality of your eggs is actually affected. So it's mostly with infections and also with endometriosis where it affects the tubes and the ovary. But if it's blocked and it's just a simple blocked fallopian tube, it has nothing to do with your period.
Okay. What does conceiving look like with a, okay, it's I don't know if you want to answer that one. What does conceiving look like with a blocked fallopian tube? But I think there again, they're talking about with IVF. So are you saying that IVF would then be the choice in that case?
Yes. So for blocked fallopian tubes, the best option will be in vitro fertilization. That's how you would conceive. That's the scenario where you go home, no license, roadblock, then you look for alternative routes, and that's IVF, and then you go through the back roads, and that's IVF, and then we go and put your baby in vaginally.
Okay. Can ectopic pregnancy cause blocked fallopian tubes?
Yes.
Okay.
It's like the egg and the hen. Which comes first? The ectopic occurs mostly because the fallopian tube is blocked. So remember, the baby is made in the fallopian tube and it needs to travel down the fallopian tube to the womb. So if the road is blocked, if the tube is blocked, then the baby gets stuck and it becomes an ectopic pregnancy because it's blocked. So, and then it causes a further blockage. And then when we treat it, we can either make a hole in that, depending, you can make a hole in the area where the ectopic is, and then you find that that also causes a narrowing of the tube. So yes, it further blocks the tube, or it can be milked out, but not everything comes out. So yes, it further blocks the tube. So it's an egg and a hen kind of thing, the ectopic and a blocked tube, but mostly the blocked tube causes the ectopic.
Yeah. Can long use of contraceptives cause blocked fallopian tubes?
Can what?
Can long use of contraceptives, so the continuous use
Oh,
of
yes.
contraceptives over a few years, can that
Yeah.
cause blocked fallopian tubes?
No, no, it does not. What is in a small percentage associated with inflamed tubes is using an intrauterine device. So women have this understanding that being on oral contraceptive tablets, injections, everything else can cause their tubes to be blocked. No, it does not. That only works on your ovary, and that's it. But then there is an association of an intrauterine device with an ectopic pregnancy, not with not to block the tubes, but it can result in an ectopic pregnancy. I hope that's clear. So can long use of contraceptives cause the tubes to be blocked? No.
Yeah. So I'm seeing somebody's posting about IU and IVF not being the only option. But I think that actually takes us to our next question with regards to conceiving with one fallopian tube. Maybe you can explain that, can I conceive with one fallopian tube? If you have one fallopian tube that is blocked, can you conceive with another fallopian tube if the other one is fine? Maybe you could answer that question.
Yes, and I'm glad you mentioned if the other one is fine, because it has to be fine. And if it's fine, you can start and finish your family goal. You can have your 4 babies with your 1 tube. It's okay. So it can happen for you naturally. Yes, it can. So the key factor is that it must be open. And then we sometimes then assist people. It's either they try on their own, or we assist them with intrauterine insemination, which is IUI. And then the thing with IUI, I saw somebody asked earlier as we're talking, what are the chances of success with IUI? We always say IUI increases your chances of pregnancy by 12%. And then with IVF, it increases your chances of pregnancy by anything between 40 to 70%. Okay. But then comes the issue of price. And then somebody said, can I not do IUI instead of IVF? And I just want to stress on the difference between those. It's one of the questions that popped up. Again, let's remember that the factory, the natural factory of baby making is in the fallopian tube. So if the fallopian tube is blocked, there's no sense in sending sperm to a broken bridge, because the sperm is not going to meet there. So IUI means that the sperm needs to be sent up through the vagina into the cervix, into the womb, and the sperm must swim up on its own. So it's just like we give the sperm a lift, a short lift to get where it's supposed to be. We just give it a short lift, like 4 centimeters, instead of traveling the whole length. We give it a kickstart, and that's it. But fertilization must still happen naturally, and it must still happen in the fallopian tube. So if that tube is blocked, unfortunately, we can't send sperm up there with insemination. So unfortunately, we can't inseminate because it will still be blocked. It will still not meet the egg. Then IVF, in vitro fertilization, is done outside of the fallopian tube. So within in vitro fertilization, we take that factory and we make it into the lab. So we make the baby in the lab. So IVF is like a substitute to the fallopian tube. We just go like, you know what, goodbye fallopian tube. We can imitate you outside in the lab. We've got the womb, we've got the storehouse. We'll make our baby in the lab instead of the fallopian tube, and then we'll put the baby inside the womb. That's basically what IVF does. But IUI still wants a healthy fallopian tube. That's why for most of my patients, I'm like, look, I can do IUI without testing your tubes. That's fair and well. But you're going to pay 6,000 Rand plus and be unsuccessful, and then only to go back and find that the tube was blocked anyway. So now we've just blown away 8,000 Rand, for example, doing an insemination with a blocked tube, which is not going to work anyway, because that sperm is not going to meet the egg. The egg, guys, does not go to the womb to meet the sperm. It stays. It's a lady. The egg is just so, it's not like our girls these days. We're like, I like this guy. Let me, tell him. I'm not going to wait for him to ask me out. I'm going to, no, our eggs are still old fashioned. They're still old school. They stay home and wait for the guy to come pick them up. So they don't drive themselves to the womb. So if the tube is blocked, the tube is blocked. The egg is just chilling there at the tip of the fallopian tube. So IUI is not an option when fallopian tubes are blocked. IVF becomes the only way.
Okay. I'm so glad you explained that, took the time to explain it. And I just want to say that the reason we do these talks is to educate women on making the right decisions. The people that we have on the other side, the doctors we have on the other end are specialists. And they're not just anyone that's just coming on here and giving a talk because they feel like talking. You guys are specialists, you know what you're doing, you've been in the field for years. You studied this thing and you do this every day for a living. So please make the right decisions by going to see a fertility specialist when you're dealing with infertility, and not just the information that you're hearing from somebody else down the road or somebody else giving you, their opinion on things. Please see a specialist in these situations. Thank you so very much, Doctor. It's always wonderful, amazing having you. I love the way you I don't know if it's called an analogy with things, the way you put things, and it always sticks in my head when you explain. So now I'm always going to remember the egg being a lady and just sitting there waiting. Thank you for that for this week.
We just have a few questions here. I picked up, somebody asked where can they get the fallopian tubes tested? There is 3 ways of getting the fallopian tubes tested. The most common one, which is also very quite specific or recommended, it's non-invasive. It's what we call an HSG, which is a hysterosalpingogram, and it's done in an X-ray department. You need a referral by a gynecologist. Even a GP can. You need a referral by a doctor to send you for an HSG, hysterosalpingogram. It costs about 3,000, depending where you are, between 3,000 and 5,000 Rand to get a hysterosalpingogram. And then the second option is if you have other diseases like endometriosis or ovarian cysts or whatever, and we need to go in and operate you laparoscopically, then we can test the tubes during that operation. So it's laparoscopic testing called chromoperturbation. And then and then the last one is done in the doctor's office by sauna, but we usually don't use that a lot. It's called hycosis and hyphosis, where they use foam and the sauna and all of that, which does at most times cannot be that specific. So it's mostly HSG. Women must just get that done for them to know whether their tubes are open or not. And then others are asking the estimation. Doctor, can I have an estimation of IVF? And somebody said there it's 75,000 upwards. I don't know. At Family Matters with 75,000, you can even get an egg donor or included in all of that. So our IVF cost is 56,000 Rand. It does include medication. It takes you from the time of starting the IVF cycle, and it includes your medication, the lab, your sedation, and the medication you get after the embryo transfer till the time of pregnancy. With 56,000 Rand, then you're able to get a cycle. It does not include freezing. So if you've got extra babies that still need to be stored for your next attempt, then there's a price, because we can never predict how many babies are going to be left behind. And we don't put all 6 babies inside the womb at the same time, guys. So that's our prices, but other centers can cost as 75K, even 100K for IVF, as somebody just put it up there. That's how much IVF is. So that's the estimation. I think, and I hope we've answered most of the questions.
There's
And
one more question that I see that's come through like 3 times from different women. They're asking about, sorry, it was about twins. Somebody wanting twins. So I think it's a question you also get a lot, like, doctor, I want twins. Can I get twins? How can I get boys? Or how can I just get 2 girls, or a boy and a girl? Please explain that.
I'm listening with my husband. I'm so emotional. My gynecologist said it's 150,000 rand. I'm so sorry, Jennifer. You can get 3 IVF cycles with that money, or at least 2.
Yes,
all right, we're glad we're helping some people, and we're glad you're getting informed, Jennifer. And we do not put more than 2 babies. We prioritize what we call SET, single embryo transfer, with IVF. And that is because a single baby has the best outcomes for pregnancy, for the health of the mother, and for the health of the baby as well. We produce quality babies. You know, I was saying how my hospital also wanted to increase their neonatal facilities because now we're doing IVF and we're going to have prem babies. I'm like, whoever gave you that analogy? We don't produce prem babies with IVF. IVF does not equal prem babies. And I promise you, I've never had any of our IVF babies going to theater. The earliest delivery we had was this last Monday, where we delivered twins at 35 weeks. Those twins were 2.3 kgs, and they went home, you know. So they were IVF twins, and they went home. We delivered today, just again this Monday, IVF baby, where the mom came. It's been a 2-year journey. The mom came, she had serious fibroids. We had to take her through theater, remove the fibroids first. So she had to go through myomectomies and all of that. And then she came for IVF, 1 cycle, pregnant, 9 months, we delivered, took baby home, like not even ICU or anything. Unless they other complications, you know, the mom has hypertension, diabetes, or any other thing that's there, but it's not IVF that causes the babies to be premature. So that's very clear. And somebody was asking where in Centurion. Yes, I'm based at Netcare Unitas Hospital in Centurion. And you can just Google Family Matters Fertility Center. You can even set up an appointment online.
Awesome. Okay, so guys, I'm actually going to, at the end of the talk, it takes about 2 minutes and the video will be loaded. And then I will put doctor's details in the bottom, like I did with last week's talk as well. And you can actually contact them directly through Instagram, send them a message, or you can pop her an email or go to their website, Family Matters, family-matters.
family-matters.co.za.
Yeah. Perfect. Thank you very much, doctor. It's been lovely chatting to you. Thank you, lovely lady. Love you too, Noni. Thank you for that.
Thank you for joining.
So thanks very much. Have a great evening, doctor, and we'll chat soon. Thank you. Bye. Bye, guys.
Good night.